Good morning and welcome to Ask Dr. Murphy, This Week in Public Health. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing quite well. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor here at Northwestern's Feinberg School of Medicine. Today, he will be addressing the latest headlines through March 6th, and we welcome any questions or comments down below or through any of our linked social media, including Dr. Murphy's new Substack page, where you can have the sources for this episode sent right to your email inbox every single week. So don't hesitate to subscribe there as well if that's something you're interested in. But starting with those stories, we have updates on respiratory illnesses here in the US. First, on COVID and RSV. Dr. Murphy, can you bring us the data?
Yeah, so the MMWR, which is the CDC publication, it stands for Morbidity and Mortality Weekly Report. It's an up-to-date journal for all the public health, all the CDC work. It's a little on the wonky side. It's not really for the public. It's for the professionals working in the field. But they reported this week on the 2024-25 respiratory season because they've got the data in there now. So for RSV, respiratory syncytial virus, there were between 190,000 and 350,000 hospitalizations. It's a range because they do these surveys around the country. And somewhere between 10 and 23,000 deaths. This is the typical for RSV. RSV, they always say, it's 10,000 per year, but the upper end is 23,000. Hospitalization rates were highest in three groups: babies under 1 year, followed by children 1 to 2 years, and then adults over age of 75. During the same period, they looked at COVID. COVID caused, remember, the RSV was 190 to 350,000. COVID was 290 to 450,000 hospitalizations and 34,000 to 53,000 deaths. Okay. The big difference is RSV and flu are typically in the winter months, like right now. COVID has two peaks a year, one in late summer and then during the regular respiratory season. So that's really the story. The highest hospitalization rates for COVID were again in those 75 years and older, followed by those 65 and to 74. So that's the story. So there's still a lot of this disease around. People should keep that in mind, particularly if you're in one of those high-risk groups.
Absolutely. Hundreds of thousands of hospitalizations still, and sadly, tens of thousands of deaths. But looking forward to this season here, we're getting more recent data on the flu activity in the US remaining high. Can you tell us those numbers as well?
Yeah, so flu is still going on. It's still going on very strongly. 8 additional pediatric flu deaths, unfortunately, bringing the total number of children who've died from the flu to 79 this year, and mostly unvaccinated, of course. And if you look at weekly flu hospitalization declined slightly from 14.9 thousand to 13.7 thousand. And thus far, in the whole picture for the year for flu, 25 million flu-related illnesses, 330,000 hospitalizations, and 20,000 deaths. With the wastewater, they determine how much is in the water, is still at high levels. So we're still in the high range here for flu.
So still something to keep our eye on as it's starting to get warmer here. Something I usually forget about is those respiratory illnesses, but they're still going strong.
Yeah, I mean, March should be the end of the big months. It starts kind of in December. January and February are the worst. March, it should be going down this month.
Now, something that is not seasonal that we are seeing outbreaks for all over this country still is the measles. Can you bring us the national total as well as where those big clusters are?
Yeah, we still have a lot of problems with measles, totally preventable disease, not seasonal at all. It's actually probably the most contagious disease known to man. 1,277 cases this year, an increase of 141 since last week. 94% are unvaccinated people, and 62 of them have been hospitalized. And in 2025, there was a record number, 2,281, since there were zero cases reported in the year 2000 when vaccination rates were much higher. Um, so, um, one in 1,000 children that get encephalitis, and up to three people with measles actually can die. So three in 1,000. So it can be a deadly disease, and it's totally preventable.
Hmm. And I understand the bulk of those cases are still in South Carolina, where this big outbreak is happening. Can you give us more information about the communities that have been hard hit there?
Yeah, well, the South Carolina is one of the leaders in the individualization of a community contagious disease. You don't want to take any vaccine, you don't have to take it. So there's one school down there in Spartanburg County where only 21% of the students are vaccinated. So this is going to be a hotbed of all sorts of childhood diseases that we thought were pretty much gone in the past. And they will spread it'll spread all over the country because there are so many pockets, not as severe as this one, but there are so many pockets with all you have to do is get below 93%, 93 or 95%, and you're likely to see cases. So it's really just incredibly unfortunate. These diseases are not going away.
Hmm. And on that note, there was a meeting by, I don't know, officials who were going to look into whether we had year-long transmission if the US would lose measles elimination status. That has been pushed but rescheduled. Could you tell us a little about that?
Yeah, there's international meetings that tell people where all these diseases are in the world and what you should be careful of. The same is true for polio. Polio is popping up all over the place again. That's another hard one to get rid of. And the meeting was supposed to be in April. It's been postponed till November, but it's very likely that the U.S. will lose the elimination designation at that time. But I think the same is true for Canada, other countries as well. Anywhere where the vaccination rate has dropped down are going to lose that status. So
Hmm.
wherever you travel, it's just going to be a lot of measles out there.
Hmm. Our final story today is a shift in topic. We have talked a lot about some of the global implications of some of these funding cuts that we've seen from groups here in the US. However, there's some really strong research about what funding cuts for HIV specifically could look like here in the United States. Can you bring us that research?
Yeah, so Ryan White was a young boy from Florida and then Indiana, and he contracted HIV because he was a hemophiliac, and then they made this big Ryan White movement to, really fight against HIV/AIDS, all these prevention efforts and treatment efforts, and the whole thing with HIV, we were getting on track to actually have the number of cases go down. So that happens when you have more deaths than new infections. So you've got to get, because we're keeping people alive longer, you have to get that new infection rate down. And we were going in the right direction. However, they're talking about eliminating Ryan White. And if they eliminate that program, the modeling that they do, these are trained epidemiologists that this is what they do for a living and have trained for. There will be 117,000 additional infections on top of the totals that we have now. That would be a 73% increase. And this is even if this is a temporary thing, like in the next 3 years, for some reason it might change after that. Uh, that this is just going to be, I mean, going in the completely wrong direction. And so we'll have HIV out there as well that we'll have to worry about. Because HIV, unlike the other viral infections we're talking about, is a lifelong infection. So you've got to be treated and taken care of for your entire life. There's no cure for HIV.
Mhm. Could have very, very devastating effects. Very, very upsetting to hear that that could be changing. We will keep our eye on that, of course. But thank you, Dr. Murphy, for your time and expertise, bringing all the latest data to us and helping us stay informed. It's much appreciated.
Well, thank you, Katie.
And thank you all for joining us for Ask Dr. Murphy this week in public health. Again, any questions or comments are welcome down below or through our new Substack page where you can get Dr. Murphy's sources right to your inbox every week. We hope to see you back next week and have a lovely weekend.